your physical health. So that's the the focus of the Veterans Health Administration, of which they do a fantastic job. And then the last element of the federal VA, of course, is the National Cemetery Administration, which again is kind of self-explanatory, where they run all the national cemeteries throughout the country. A little caveat for us here in Maryland, of course, that the national cemeteries are essentially closed with the exception of the one in Baltimore. The Baltimore VA National Cemetery is open and eligible for cremains only. They do not accept casketed burials in Baltimore. They accept cremains only. So those three elements of the one VA, they network with one another, but as we all know, there's kind of some holes in networking, or there can be some holes in networking at some time, at different times. So what does a veteran do in order to kind of sit down and make sure that they're aware of all the different things they may be eligible for? With the VA, there's a lot of if this, then that, so if you're service connected, that can open up a whole different network of ancillary benefits. Or you may not be eligible to enroll in VA healthcare because your income is over their limit. But if you establish a service condition, how does that affect your eligibility to healthcare? And so they can be kind of confusing. So what does a veteran do? Well, that's what we try to achieve at the Maryland Department of Veteran Affairs. We try to kind of fill in those gaps where we can. Now, our agency, again, is a state level agency. So we don't have hospitals, clinics. We don't adjudicate claims such as the Veterans Benefit Administration does. But what we'll do is we'll sit down with an individual veteran, a dependent or a survivor, and then we'll kind of help them navigate through that system. What does this mean? If this, then that, what might I be eligible for? So that's kind of where we try to fill in the holes. The one pager you see up there is just talks about some of our programs, and I want to just take a minute to kind of highlight all 5 of them because they are important. I'll leave the most important program that we have, which of course is our service and benefit program that I run, till last. That's the most important. We run our Maryland State Veterans Cemetery System. Now, we mentioned that the federal cemeteries in our area are essentially closed, with the exception of the Baltimore National Cemetery that accepts cremated remains only. So how does a veteran then access their benefit of being buried in a state or a national cemetery at no charge? So that's where we kind of fill in the gap. We do have 5 state cemeteries in Maryland where a veteran can be interred at no cost. There is a small charge for a surviving spouse or a dependent. Our 5 state cemeteries are located in Cumberland, in Western Maryland, on the eastern shore, a little town called Hurlock, which is between Easton and Cambridge. And down towards Southern Maryland, we're located off of 301 down there in Cheltenham. In Baltimore County, we have one out in Garrison Forest, which is in Owings Mills. And then the hub of our cemetery program is in Crownsville. You can see the contact information on the one pager there. It's just my experience, and I'll just kind of put that out there, that I encourage, our cemetery does accept pre-need registration, so that at the time of a veteran's passing, of course, it's a very trying time for a family, and what typically happens, and we see it a lot, veterans or their families are fumbling around looking for a DD-214 for verification of service. We're trying to put all that stuff together to get the veteran interred in a dignified manner. I suggest that every veteran or every family member, if being interred in one of our state veteran cemeteries is something that you desire, take advantage of the pre-need interment, fill out that application form, contact our cemeteries, get your DD-214 of record, so that at that time, and that time comes for all of us, you don't have to be fumbling around for that document and just making a challenging time for a family more challenging. So I'm already pre-registered. I definitely recommend that to any veteran whose wish is there. And just as a side note, even too, put a will together too, because you know my wife wants to be cremated. We're both going to go to a state veteran cemetery. I cannot stand the thought of being cremated. I know where I'm going, but somebody burning me up, it's just, I just can't get over that. So I've made sure that my kids, I have 3 girls, they all know, do not let her burn me up. You know, put me in a casket, and that's how I want to go. So anyway, make sure your family is well aware of your final wishes.
Philip, I apologize to interrupt you. We probably have about another minute.
Oh, wow. Okay. So let's
Yeah, sorry
talk
about that.
the trust fund for a minute. Let me jump right to our let me just jump to our program. I run a network of 13 locations throughout Maryland that I have veteran benefits specialists that will sit with a veteran, one-on-one, a veteran, a dependent, a survivor, review military separation discharge documents, DD 214s. And our job is to kind of get into the nitty gritty, the details of helping them apply for the benefit that they've earned through service, whether it be disability compensation, non-service connected pension. We can help with enrollment in VA healthcare. So you see our locations on our one pager there. You know, I definitely recommend that you reach out, contact one of them if you're interested in those kind of things. We're kind of the go-between between the federal VA and just to kind of help, you know, with the nitty gritty of it all, review the process. All of our folks are accredited, so they have remote access into VA claims tracking systems, and they can look up claims as they process through the system right at their desk. I'm sorry, I thought I had a few extra minutes there, but happy to answer any questions.
All right. Thank you so much. Yeah, my apologies. I hate having to do that.
No problem.
Okay. Last, I'd like to introduce, and I apologize, Nathan. I should have listed how do you pronounce your name? Stugin?
Studgeon. So Studded Gin. Yep.
I got you, Studgeon, who is LCSW BCD director with the Baltimore Vet Center. So thank you for joining us this morning.
No problem. Thank you for having me. And Phil, thank you for taking some of my thunder so I can have a shorter speech today. So we do at the Baltimore Vet Center, we do readjustment counseling. We focus on, you know, practical therapeutic services that really help the veteran and their families really reacclimate to society on a day-to-day basis. You know, we look beyond just kind of what therapy dynamic can we throw at them, but it's, you know, really how can we help them utilize those skills and be successful in life. So as far as, you know, who we are, you know, we're located within the community. I think there's over 300 vet centers nationwide. Here within Baltimore, we have PG County, Annapolis, Elkton, Dundalk, the Baltimore, and Silver Spring. So there's a variety of vet centers that, you know, that veterans can access just within the Maryland area. That they don't really have to travel that far. I would be remorse if I didn't mention have Stephen Fife on here. He's the veteran outreach specialist out of Dundalk. So he's, you know, one of our go-to guys when we're doing outreach like this. I have Fidel here in house in Baltimore. They kind of our boots on ground. They really help us get out into the community, spread the word out. Surprisingly enough, a lot of people really don't know about vet centers and really what we do. You know, we really help the veteran and meet them where they are at, you know, clinically. Oftentimes we get referrals for claims and benefits, but we really don't have anything to do with the claims process. So, you know, if you have somebody and they get directed, you know, to us for claims, we can't really help them beyond just helping them with what the, you know, the mental health issue or diagnosis is. Another, I guess, common maybe misconception is even though we do staff our vet centers with clinicians and licensed clinicians who are able to diagnose, in-house we do not diagnose. You know, we treat the symptoms, and that is our focal point. So oftentimes when they do come to us for claims, we can just give them the records, and that's pretty much it. Let's see, and then as far as eligibility, I mentioned, and I'll put in the eligibility in the chat, but it's become a little bit more expansive. It used to be very narrow focused with having, as far as focusing on active duty that has served in the combat theater or area of hostility, military sexual trauma, regardless of gender or service area, and bereavement services. Since about a year or so ago, they've recently expanded that, and so now we can serve quite a bit more veterans, and including current reserve components assigned to military commander drilling status. Including active reserves. I think the biggest component with the vet centers, though, in differentiating from the VA services, our services are truly confidential. We oftentimes have service members that might be have clearance, or if you work for another government agency and you're concerned about them being learning about whatever mental health struggles you're going through, unless there is an issue where your safety or somebody else's safety is in jeopardy, nobody's going to know you walk into this vet center unless you tell them. We also have mobile vet centers. There's a fleet of 80 vehicles nationwide that they go and kind of extend, our vet centers, our reach to some of the satellite areas or, remote areas. Oftentimes, even when there's a national disaster, we are deployed to offer additional services and mental health support. We also offer CAPS locations, so community access points. So that way we can, we're not just at brick and mortar, we get out into the community, we're truly out and try to be, as much of a resource as possible. And then after hours, if you call the vet center, you'll always get somebody. We have the vet center call center, which is a around the clock confidential call center where veterans can contact. This is separate from the crisis line. This is the vet center specific number, and they'll connect you with a vet center after you're done talking with them. They're not necessarily set up for therapy ongoing, but it's just enough to kind of get you pointed in the right direction if it's after hours. So that way, the veteran's not by themselves. Let's see, Stephen, did I miss anything?
I think cover most of it. I mean, just to highlight a couple of things I always like to talk about with the vet center that a lot of times get overlooked too is we can see your family members. As long the catch there though is as long as it's somehow related to the active duty service member or veterans treatment goals. So it can't be their own issue. But a lot of times, at the VA hospital, that's where a lot of times it gets confused is they can only usually see the veteran. But with the vet center, as long as it's somehow related to the service member veterans treatment goals, we can see the family member either as a couple or individually. We even have a spouse group at our vet center, which I know a lot of other vet centers do too. Also, the ease of access and use of the vet center is something that really is a part of our program that shines that we often forget to tell everybody about. When you come to our centers and you're scheduling your appointments, you're scheduling directly with your counselor. You're not going through a switchboard or a program support assistant that's putting that in there and you're not sure when you're going to get your appointment. As a former vet center patient myself, I scheduled directly with my counselor when things would pop up, that same week of my appointment, I could easily switch it. So it's very easy to do. We're actually opening up our new access point at the Reserve Center outside Fort Meade starting next week. So that'll be coordinated through here at the Dundalk Vet Center. So like Nate was saying, we have our access points throughout the community. And just also, we're just a good community resource. People walk into our centers not knowing what this big VA is and what the VA covers. And people come in here asking questions all the time about stuff that we don't cover. However, we can usually point them in the right direction of how to utilize the VA in their local area and make it as easy to use as we can. I think that's about it.
Yeah, I think one other thing, we do offer a lot of group therapy as well, in addition to individual. So that really helps with that connection piece. And then as far as referrals, it's really as simple as finding the vet center that's closest to you, finding that number and giving us a call, indicating you have a veteran that needs to be seen. And, usually they have to reach out to us, but if it's a service provider, we can also kind of work. And if there's some barriers there, we can definitely help them get access to care. And then I also saw something that Dana put in the chat as far as having a child play area. That was still there. I think that's going to be changed. Steve, you might be able to hit on that. But as far as, working with kids, with children, that's the unique part about the vet centers. We have a lot of flexibility as far as the therapeutic modalities that we can offer. But the main component, like Steven said, is it has to be directly related to the service members, presenting issue. So, for example, if there's some parenting stuff, we can bring the child in and we can do some, modeling or, parenting skills in-house. Sometimes we offer parenting support groups or skills groups, depending on what the vet center and what services are needed at that time. So.
Okay, thank you very much. I got to cut you guys off. I'm so sorry. But before we turn it over to Ann, I'd like to turn it back over to Dr. X for a second. He wants to just show a quick slide, and then we'll turn it over to Ann for our discussion. But thank you to all of our speakers this morning for all of the information. We greatly appreciate it.
Fantastic. Thank you, Kim. I appreciate that. I wanted to swing back around to Bobby. So sorry for the technical difficulties at the beginning, but I wanted to give you an opportunity to highlight anything on this slide before we turn it over to Ann. Bobby, are you there?
I am here, thank you. And I don't know if this can be sent out to folks.
Yes.
But those items that are listed in red are actually links, so you can link to those sites. And then there is the QR code that I mentioned for veterans to schedule appointments. And that is a national, excuse me, that's a national link. So when veterans go to that site, they select the office that they would like to have their appointment at, and then they can make the appointment either virtually or in person through using that QR code.
Fantastic.
That was it. Thank you.
All right. Thanks, Bobby. Appreciate that. Next, we're going to turn it over to Ann. Over to you, Ann.
Thanks, Bobby, and Tequila, Philip, Nathan, and Steve, I believe, for really presenting and sharing the benefits that veterans have access to. It is complicated and complex of navigating all of this, and the if this then that is complex. So I appreciate Phil mentioning that. If you all can put your contact information in the chat, because this next 15 minutes or so is just going to be a lot of Q&A for you all and conversation. And if people don't have time to ask all their questions, they can follow up with you. And real quick, before we get into some questions, we have a waterfall question that you can reflect on and then put into the chat. And when I say go, you can send your response to the whole group. And the question for you to reflect on is, why don't veterans sign up for benefits? What is a reason or two why you think veterans don't sign up for whatever reason that you've encountered? So think about that for the next 30 seconds. And then when I say go, you can put that in the chat. And that will really tee up the first kind of question conversation with our speakers. Our speakers can kind of take a look at that and tell us a little bit about their advice for helping us think through how do we talk to veterans so that they are inspired and have the resources and capacity to access what they need to access. So if you have the time to reflect on that, if you can hit send, and we can look at your responses. I don't need it. I don't think I'm eligible. The process is not easy. The debate between private insurance, VA. Don't know where to start. So if our speakers could scan through that, and I'll just leave it to you all, to whoever wants to speak first, about how to address some of these in the chat.
Well, Ann, this is Phil Munley. I'd just like to speak to it because by the time I would actually get done typing with my typing skills, we would never really get through it, to be quite honest with you. So I'll tell you the primary thing that we notice, at least through my organization. Applying for a benefit for a lot of veterans is just, it's not important to them until it's important to them. A lot of folks, and it's generational in a lot of cases, a lot of folks from generations from many years ago feel like, well, there's nothing wrong with me. I'm just going to go on with my life and save it for someone else. Or to the younger generation, even that gets out and, maybe returning to school or to work or might have a family, that's their focus. And so they move on to that. So it's really just not important to them until it's important to them, which is not a good thing, because as we've been discussing, all this stuff is a process, and nothing happens overnight. And one of the primary things that we're you know, I would say we field at least 5 calls a day now for our World War II and for our Korean War and for our Vietnam veterans that have advanced to an age where in-home healthcare is important to them. Monetary benefits are important to them, those kinds of things that if they've never done anything, now they're kind of fumbling around looking for that DD 214 that we mentioned, trying to enroll in the VA healthcare system. So, you know, if there's some eligibility for some in-home care that to set that up, you know, all those things it is a time consuming process. So for our younger generation, I would say, you know, you serve, you're not taking benefits from anybody. The main process that I try to use is if you're not going to do it for yourself, and you have a family member, a wife or a child, do it for them. You know, don't do it for you, do it for them. So things are in place that, God forbid anything should ever happen to you, that things aren't as cumbersome getting it moved forward. So, you know, that's just kind of what I experienced.
There was a lot around also the idea that not only like, I don't need this, but the process is just challenging. I wonder if you, one of you all can speak to even your own benefits. Like, do you have tips and tricks of how would you navigate your own benefits? Like, what have you seen that really stops people from getting to the point where they actually can get that benefit? Any tips and tricks for us as we kind of talk to veterans we serve, how to really smoothly access the benefits?
Did you want me to take that one in?
You can, yes. And any of the speakers can jump in too after Phil.
Well, I think that the tips and tricks would be to ensure that when you submit a claim, you know, things can be very detailed. So what you want to do is if you have some kind of an injury or an illness or disease that you experience as a result of your active duty, and you now want to file a claim to Service Connect that, let's make sure that when you sit down, don't make assumptions. Well, that's going to be in my record, or, well, you know, I heard this, or sit down with someone and make sure that's as detailed as possible. You know, I hurt my knee, but I never went to the doctor, and here I am 20 years later, now I need a knee replacement. Well, if you hurt your knee in the service and you never went to the doctor and it's not documented in your service treatment records, then you're going to have a difficult time proving that the condition now, 20 years later, is related to what you did in the service. So sit with someone who has an understanding of the process that can get into the nuts and bolts and the details of it, so that you can submit a complete package with the necessary information in advance, rather than getting into a letter writing, you know, with the VA. You submitted a claim. Now the VA is going to send you a letter saying, this is what we need from you, and you're trying to find it, resubmit it to the VA, which is just going to kind of drag things out. So get a complete package together from the onset is what I would say, and make sure that you're working with someone who understands that process. Bobby, that's what I would say. I'm sure you would have a little more to add to that.
Yeah, I was going to say essentially the same thing, Phil. Is I think it's key that veterans, especially our older veterans, you know, a lot of our younger veterans are a bit more tech savvy, and you know, they don't have any problem going on va.gov and doing anything that they need to do. But I think it's very important that veterans find a representative, a service organization. I mean, we have a lot of veterans that have private attorneys. You know, there's different opinions on that, but I think our veteran service organizations are key to veterans being able to go through that process, because it is complex and it is difficult. And, you know, as Phil said, you know, if this, then that, you know, and there are cases, the example that Phil used, where maybe a veteran hurt his knee or hurt his back, his or her back, and they didn't go to the doctor, you know, they just, you know, maybe went to sick call or something, or just their, you know, platoon sergeant let them take a day off, or whatever that case may be. So they just recovered from it. But there are other stipulating factors in there that we can look at in a case like that, where, for example, a veteran hurt their knee. They have no record of that in their medical records in service, but they have the paratroop badge, or they have a combat badge. You know, those are sorts of things that can be considered that maybe not may not be in medical records, but there are other indicators where we can, determine without a reasonable amount of doubt that, this likely happened in service, that, maybe they got hurt on a jump, maybe they, if they have a combat badge, maybe they were injured during combat and just didn't go to the doctor. So there are a lot of assumptions that veterans make that, just may not be incorrect. So, or may not be correct. So like Phil said, just don't make assumptions, go through the process and then let the compensation process make those determinations. The records are important, yes.
And I want to lift up what Dr. X prompted in the chat, which is anybody feel free to kind of share what you have to offer or your insights on this topic, or ask a question and post something that you've been challenged with or struggling with that this group can help problem solve.
I think if I can just add on to that, whether it's, primarily clinically, but also, benefits wise, I encourage every veteran that I work with, I encourage and I empower them, because this readjustment component, it's not just, getting acclimated, it's learning how to become, assertive for yourself as well. And a lot of times you see this big system and, the chain of command, you can't go against that. And so now you have to learn how to advocate for yourself. And I tell every veteran I work with, it's, this is your treatment. You have to step up and assert yourself in this because you know what's best for you, for your system right now. And so, in doing so, and that goes as far as, if somebody lets me know that they're filing for a claim, sometimes, I'll let my notes be a little bit more descriptive, but they have to assert themselves and let me know that up front. As long as it's going to be beneficial.
Bobby,
I'd
one-
like
sorry,
to
go
add
ahead.
to that. I think everybody is saying one thing that's obvious, but we don't always say it out loud, is that we have to be relatable to them. And I found that I use a sales approach, a feel, felt, found. I feel the same way. I felt like that when I was applying for my disability. And what I found is this. And when I've talked to veterans and they've had their challenges, that's the first step to me, is just making sure they understand that what they're feeling is not a unique feeling. It's not something that's wrong to feel that way, but that they can move beyond it, move through it. And always sharing our experiences with many of us being veterans goes a long way to getting them at least to the point where they say, all right, I'm gonna try it again. I don't think it's gonna work, but I'm gonna try it. And then staying with them and making sure that they have that support when you're able to, or through your people. So I think that's important.
Fantastic. Cynthia.
Yeah, I don't know if this is at every regional office, but I wanted to toss this up to Bobby because I know y'all have some of the VSOs that have desks available there at the regional office at the Fallon building, because that's part of it too, is figuring out there's so many VSOs, which one's right for me. And if you could just kind of talk through that piece of it, of actually hosting some of those office spaces for them there.
So we do, you're correct, we have VSOs in office at the Baltimore office, and I've only been assigned to one other regional office, which was Atlanta, and they also had VSOs in the same building with them. So I think it's fairly common to have the VSO representatives in the same building as a service center. And though some of those are like DAV, VFW, American Legion, MDVA, all of those folks are service organizations that are available for veterans. And I think Phil maybe will just speak a little more about some of the things that VSOs can do for veterans. But yes, we do house several service organizations in our building at the Baltimore office.
Any other last questions? And you can always use the chat. I know we're running out of time.
I have a quick comment. I'm typing, but it'd be faster just to say it. We had held focus groups with women veterans last spring, and there was a woman veteran who was on the call who shared with us how she utilized both her private insurance and her VA healthcare to cover her prenatal care and her delivery, to the point where literally it was no cost to her. And I've thought a lot about what she shared and how we do business within MDVA. And I've really tried to flip the narrative. We are such a fast-paced society now. What I'm trying to do is think about it like what's in it for the veteran and or their dependents. Like see the application for and receiving benefits in healthcare as a product. Like, why do we go to Target? Why do we go to Walmart? Like, I want to get in, I want to get out. So it's developing a pitch that will encourage that second thought. That has, I don't know, it's just kind of like flip things on its head for me. How do I quickly get the message out there? Because I think we are, as a society, growing increasingly impatient. We just want to know really quickly, like what's in it for me. So, I mean, that's just kind of what's helped me from an outreach perspective and, you know, how I'm educating veterans and encouraging them to reach out to the VA.
Thank you. I think I'll pass the mic, so to speak, to Dr. X for kind of any closing. And I also see you put in the chat that if you are able to hang out, like in terms of coffee chat, if you still have your coffee, we can hang around for about 10 more minutes and really have some more question and discussion period.
Fantastic. Thank you so much, Ann, for facilitating the group discussion. I appreciate that. Again, for those of you that have back-to-back meetings, truly understand if you have to pop off. But for those of you all who need to stay on or want to stay on, please feel free. Just wrapping things up is a reminder that serving together is peer navigation. So as you coming to serving together, we help those veterans, family members, service members get what they need so that they're not overwhelmed and having so much anxiety about where to go. So just keep that in mind, that serving together will help with that peer navigation. I also want to give everyone an opportunity to share any news from their organization. Any upcoming events, any exciting things that you want to share. Over.
All right, I got to put a plug in before I jump off. I have another meeting, but we actually have an event coming up on August 18th, and it's actually a drive-in movie event at Benji's Drive-In, 7 o'clock, family friendly. Tickets are $75 per car, and that is for anyone, you know, safe that you can put in a car. And that $75 includes the movie, which is Jumanji. It also includes food from Mission Barbecue. We have face painting, non-alcoholic drinks, and 100% of what we raise that night goes to the Baltimore station. So gotta put a plug in for that. And you can just go to our website, baltimorestation.org, for more information.
Fantastic. Thank you for sharing that, Kim.
Yeah, thank you.
Anthony?
Thank you, sir. Tomorrow we will be having the Veterans Career Club. This is a monthly event that we do virtually that brings together veterans, professionals like yourselves, and employers to what we call SOAR, share opportunities, advice, and resources. It is at 11 o'clock tomorrow. It's free to anyone. Again, veterans, spouses, dependent, caregivers, everyone is invited. And if you pop in, it's an informal discussion, kind of like a town hall. Dr. X and a number of other people on the call have been in there before. If you pop in and I see you, I'll give you an opportunity to be on the mic. And I'm putting the information into the chat so that you can join us. There is no need to register, just pop in with the link. Thanks.
All right, fantastic. Before everyone jumps off, I should have launched this earlier, but we'll see what the numbers look like once you take this poll. We're looking at next month, skipping next month just to give people maybe a summer break, at least 1 month off, just in case they want to go out and do different things. But just wanted to poll the group. Should have done this earlier, but at least this kind of shows us what people are thinking. Give you a few more moments to do that. In the meantime, if you want to share your information, your contact information in the chat, please do so, because after the call, I will be sharing this information. Okay, I think most people have finished the poll. Let me end it and share the results. Looks like most do not want to skip next month's meeting, which is great. That's fantastic. So we're going to keep it moving every month. We're going to keep it consistent. So I appreciate your participation in the poll. All right. Let's see, where are we? Okay, anyone else? Let me see, are there any hands up? Don't see any hands. All right, well, that's what I have. Well, I want to give an opportunity for my crew or it looks like Cynthia. Yeah, and Cynthia, do you have any final comments?
No, I learned a lot as always, and I look forward to next month to keep this moving.
Fantastic. Cynthia? All right, she may not be available at this time.
No, sir,
So-
thank you.
Okay, fantastic. Thanks again. I appreciate your time. Have a great week and see you next month. Take care.